Pediatric over-the-counter OTC medications for emergency preparedness. Lindsay Dalton and Ying Han, University of Connecticut School of Pharmacy. By experiencing the COVID-19 pandemic, we realized that during disaster, healthcare resources may not be readily available. This results in the need for families to self-treat common illnesses in children. Therefore, pharmacists hold a unique position where we can prepare parents for emergency situations by recommending and counseling on the most useful over-the-counter medications to have on hand. In this poster, we focus on demonstrating the benefit of OTC drugs for treatment in emergency situations, describing counseling points for pediatric OTC drugs, establishing which treatments are appropriate for certain age groups under certain conditions, and reviewing pediatric OTC dosing. Previous studies have shown that emergencies can highly impact children's health. Multiple factors can contribute to the onset of symptoms or exacerbation of medical conditions in children. In this case, caregivers may seek OTC treatment for their child. Therefore, it is critical to educate caregivers so they know what medications to have on hand. This flowchart in the center of our screen provides examples of how certain emergencies can influence a child's health and which OTC products would be beneficial for treatment. Hurricanes can create a high humidity environment with large amounts of precipitation. This can easily lead to the development of mold in the child's surroundings and trigger the onset of allergic rhinitis. Allergic rhinitis would likely cause the child to experience runny nose, watery eyes, pruritus, and sneezing, among other symptoms. Therefore, it would be beneficial for parents to have intranasal corticosteroids and/or second-generation antihistamines available for treatment. The increased moisture from flooding creates the perfect breeding ground for mosquitoes. An increase in the mosquito population increases the chance a child could experience itchy and/or painful bug bites. These symptoms could be treated with common OTC items such as topical hydrocortisone, second-generation antihistamines, and/or analgesics. Wildfires are common in certain geographical areas of the United States and tend to occur in the summer months. They can generate large amounts of ash and smoke that pollute the air, which has the potential to exacerbate allergies in children. If families live in certain areas where there is a high fire risk, caretakers can prepare by purchasing intranasal corticosteroids and second-generation antihistamines that would relieve allergy symptoms. As we've seen with the coronavirus, pandemics can cause widespread infection. As fever is a common symptom of many infections, it would be beneficial for families to have antipyretics readily available. You may recall that around this time last year, it was very difficult to find Tylenol early in the pandemic as individuals rushed to prepare for the impacts of COVID-19.
While counseling the parents on the medication in each category, we emphasize three main additional patient education pros, which help safely and appropriately administer the OTC medication to pediatrics. First is the medication error. As we have known, a medication error can occur anytime and more often during self-treatment. Pharmacists should educate caregivers on how to read the package label. Pay attention to the age limits, the dosage form, because the different dosage forms may result in different dosing regimens. Be aware of dosing based on the weight of a child and understand the general cautions. Secondly, overdose incident may happen. It may be due to the medication errors during administration, or it may be due to the unsecured storage of a medication, which lead to a children overdosing the drug themselves. The pharmacist can recommend the caregiver save the number of poison control center on their phone and ask for help 24/7 while facing overdosing incidents. The third important point is the tips for dosing. Pharmacists should educate caregivers on using the appropriate dosing device only to give the correct amount of medication. In case they don't have any at home, they could reach out to the local pharmacy. While applying topical products to the kids, keep in mind hand hygiene. Make sure to wash hands before applying any topical to prevent possible infection. Also, teach them to use fingertip units for dosing topical products to get an adequate amount of medication for treatment. To sum up, it is important for parents to have these OTC medications on hand, especially under different emergencies and drug shortages. Parents should know how to use these medications appropriately for self-treatment in their children. By counseling caretakers, pharmacists, who are the most accessible healthcare professionals for parents, could maximize the role for patients' education and safe medication use in the pediatric population. Please review the handout attached to our poster, which in the following slides, for detailed medication information in each category. In the handout, we are including appropriate age for using, dosing, adverse events, pertinent counseling points, as well as when to refer to a pediatrician. Thank you so much for your time and listening. You have a very nice day.